Welcome to the latest episode of the Public Health Insight Podcast, where we delve into the latest news and trends shaping the way we think about public health and the world around us. My name is Gordon, your host for this episode, along with my co-host Bindra, and together in this episode, we have a fantastic lineup of intriguing topics that are sure to get you thinking. We'll start by exploring the cost of living crisis that's impacting people's physical and mental health.
Next, we'll discuss a concerning new trend in drug advertising involving patient influencers on social media.
And finally, we'll look at how urban planners must look beyond cities to promote exercise and improve public health. Let's get into it. The cost of living, including housing, food, and healthcare, has been increasing, making it more difficult for people to afford basic necessities. The cost of living crisis is a public health issue because it negatively affects people's physical and mental health. The stress of financial hardships can lead to mental illnesses such as anxiety and depression. The harsh reality is that when people have to choose between basic needs like food and healthcare, it can lead to long-term health consequences. Robust policy options are needed to address this crisis and reduce income inequality. Bindra, what's your take on this?
So I think over the past couple years, or especially the last year at least after the pandemic, we've been seeing prices rise so drastically, especially in terms of like food with groceries and stuff. So that was my biggest reaction to this, just realizing how expensive everything has become. And people's salaries are not increasing in the same way that everything else in terms of our basic necessities are increasing. And then I always end up wondering, how are people affording this with incomes that are not even of a livable wage? I think right now I'm someone who lives in Toronto, and I've been reading articles on to actually afford living in Toronto, people need to have at least a minimum income of a year. And then you look at how the minimum wage in Toronto or Ontario right now is around $15, maybe $17 an hour. And that's nowhere near enough to allow people to live in the city. And you think about how people will continue afford living like this, especially as prices continue to increase, as things continue to become not affordable. So it really made me think and realize that there are public health impacts to this, and how can we actually do our part to help those who are most affected.
I'm glad you flagged the working poor side of this too, because in public health, we often think about people who are unemployed, and rightly so, people who might be experiencing homelessness, rightly so. There's also the other component of this too, where people are working and earning less than what they need to meet the basic needs of themselves and their family. And as the cost of living increases, more and more people and families will fall underneath the poverty line. And that creates a lot of different challenges, whether it's physical health, changing what your family eats. It might go from more nutritious foods to less nutritious foods. You might eat less frequently, leading to food insecurity. That's a health challenge as well. Maybe you have to work a longer job, and then that gives you less opportunity for self-care, spending time with your family. So there's a lot of different physical and mental health implications from the cost of living crisis. And that's why the author for this article is flagging that cost of living is a public health issue because of all the public health implications that surround this. For this article, they made an interesting point of mapping out the different consequences of increasing costs of living. And it just goes to show the massive trickle-down effect of income, right? So affecting energy use. So are you then now sacrificing heating in your home so you can afford food and making other tough decisions, taking out more debt to provide for your family? And it has a lot of different consequences. So I started to reflect on this, and I thought, should public health's role just be based purely on working on income-based policies, because a lot of what we're trying to address in terms of the social, in terms of health, they invariably tie back to how much a family or a person makes. So should we not just focus on that and forget everything else?
So I think this is definitely a complicated question.
Mm,
For sure, 100% agree that income is the number one factor because it influences so many different aspects of our life, right? It influences things like what we eat, to our housing, to our transportation, to even the type of education that people can get. I think it plays a factor in every single thing that allows us to survive. So definitely efforts need to be put towards income. And I think particularly maybe even like paying employees fairly, like fair wages.
mm,
And does it really make sense to have the minimum
mm.
wage be so low in a place where things are so much more harder to afford? I think we need to really think about working together with maybe labor regulations and figuring out what is a fair wage for people to be paid to afford the way that for to afford realistically basic necessities in life, not even anything beyond that. So I think that is definitely where public health can come play a part. But I do think that there's other aspects in addition to just income that public health should obviously play a role in. And it goes to show that it's more than just individual income, but more so at a higher like community level, at a higher level, like the way that communities are structured and built. I think that also plays an impact in terms of how people are able to live. Even things like commuting, people who are commuting to their work, they're spending more time doing that. They're spending less time on themselves and maybe buying groceries. Maybe they have to buy something like buy fast food very quickly and things like that. I think everything has such a huge impact outside of just income in terms of how people are living and how that's impacting their health in one way or another. So definitely income is the number one thing. I definitely agree with you on that, but there are other factors that public health should be involved in helping make policy changes and program changes. A new trend in drug advertising involves patient influencers promoting medications on social media. While traditional drug advertising is regulated, patient influencers are not subject to the same scrutiny. There are concerns around the credibility of patient influencers, as many lack medical training or expertise. Additionally, patient influencers may have financial incentives to promote medications that do not align with the best interests of public health. Regulations around drug advertising need to be updated to address this new trend and protect the health of the public. So, Gordon, in terms of this article specifically, when you initially read it, what was your take on this and the whole concept of patient influencers versus social media influencers and how exactly these individuals have an impact on folks who are taking certain medications?
Yeah, this is an interesting one because it's surprising and unsurprising at the same time. So I'm sure a lot of people are familiar with the traditional pharmaceutical advertising. You see an ad on the screen, you see the patients, you see the drug, and then there's a little fine print at the bottom, and someone might read the disclaimer really, really fast, and those ads are generally targeted for people who have been diagnosed with a specific condition or are struggling with something in terms of symptoms and are looking for a way to remedy that through with the help of drugs. The article also talks about, in terms of the degree of success of TV ads, for example, that half of the people who saw the ad, who spoke to their healthcare provider about the drug, indeed ended up being prescribed that drug for whatever condition that they had. So you could see that those types of advertising are incredibly effective. The challenge with that nowadays is since COVID-19, there's been more of a questioning about institutions, governments, pharmaceuticals, and that necessitated them taking a bit of a different angle for marketing and advertising. And patient influencers were identified as a potential avenue to market drugs and social media platforms. So my reaction to this is essentially, I think there are good and bads to it. There's goods in that there's people that are struggling with health conditions for a while and haven't been able to find a solution with their healthcare provider and are looking for any type of answers. And at the very least, what this would be is within this patient influencer or group on Facebook or whatever the case might be, it builds a community of people experiencing the same thing, and it can support each other and not feel alone and isolated. The extreme of this in the other end is that you can have this being used for the wrong intentions, where without the ethical considerations, people shamelessly try to promote these drugs, whether it's patient influencers or other people, and it's purely a profit-driven endeavor for them. And then I think that can do more harm than good.
Yeah, I definitely do see where the positives come in terms of this, because people, when it comes to advertisements and marketing, they want to see someone that they can relate to, right? So if they see a patient who possibly is going through the same thing that they're going through and they're telling them the benefits of using this drug, then they're likely going to go towards buying it. I feel like this is personally even myself, like when I'm searching up a new like skincare regimen to find, I'll go to YouTube and find reviews of it and people who have actually used it. And usually people mark these as, I'm not an ad, this is my honest review of this. And that leads me to actually wanting to buy the product, because I've seen someone who is just like me, who's used this product before and is giving an honest review of it. And I think similarly that can be applied to these patient influencers as well. So I think my reaction to this was, I think it's good that we're using these as a form of marketing and trying to get those folks who may not necessarily want to buy these drugs through other means. But I guess maybe a question for you, Gordon, is how can regulations around drug advertising possibly be updated to better protect public health in a way? Because this does impact public health, right?
Mm-hmm. One dark side of this, I know we talked about the positive utility of this, that hasn't necessarily played out to the extent that we would have liked. So what we tend to see is a dark side, which a more recent example of that is Ozempic, which is a drug for diabetes, where the side effects of that drug could include things like weight loss and slimming, and that you have to toe a very careful line with that, because folks who might not have an understanding of medication, drugs, physiology might promote it based on their singular experience, and that can do harm to the masses, especially for patient influencers or anybody else for that matter that could have a stake or something to gain from it. It could do a lot more harm than good. And what we did see in terms of the population level impact is drug shortages. And if you think back to even during the COVID-19 pandemic, when there was a misconception or false belief put out in the media that hydroxychloroquine, which is an anti-malarial drug, could treat COVID-19 effectively, then you saw shortages in that type of drug as well. So what we're seeing here is that patient influencers with a large following have the potential to create drug shortages. And that's why we should proactively address this, because those swings based on fads and new trends have the potential to... You go to the pharmacy to get your drugs and you're told that it's not there, and you actually have diabetes and you need to get your medication. So it does impact everybody, and regulation should... my understanding is that there's something already there on social media where if it's a popular figure, they have to indicate if it's an ad. But who, for these medications that are prescription only, I'm not really clear on how someone can get access to these on the legal regulated pharmaceutical market. And I'm not sure why healthcare providers would prescribe these for reasons other than what it was intended to do, off-label. So I'm not really clear on that. So perhaps maybe that's when healthcare providers are the gatekeeper, I think a lot of the regulations should target there. I'm not optimistic that we can do too much on social media. That's my take.
Yeah, that's a really fair point. I think many of these influencers probably don't even realize the amount of power they hold with all of this following and the potential negative impacts that they could have from what they're sharing.
Urbanization has been linked to a reduction in physical activity levels, contributing to numerous health problems such as obesity and heart disease. This article argues that urban planners need to look beyond cities to promote exercise and improve public health. Solutions such as creating green spaces, improving access to public transportation, and building bike lanes and pedestrian paths can encourage physical activity and reduce health disparities. Bindra, why is this important?
So this is super important because many people don't realize the impact that the built environment can really have on our health. And the way that we live, the way that cities are designed around us, it makes a huge impact on how we actually live our day-to-day life. Like if we have no bike lanes around, if there is no green space around, it's very less likely for us to actually want to go outside and do physical activity. And having these spaces be incorporated into our day-to-day living, I think it really just promotes physical activity. It ensures that we don't have a lifestyle that's not as physically inactive. And I think it's really important. And we need to ensure that public health is working collaboratively with planners, with urban planners, to make sure that cities are being built in a way that promotes physical activity and these lifestyles that are more active.
Mm-hmm. One of the key things that stood out to me in reading this work, because it has direct implications to me in the work that I do as well, is the idea that what works for urban centers in terms of urban planning or city planning out a city doesn't necessarily work for rural communities and suburban areas as well. So that's my biggest takeaway from this particular article. And the way cities are designed with bike lanes and connectivity to access to healthcare or different facilities for recreation won't necessarily work the way it's intended if it's transplanted to a more rural, a more disconnected community. So specific approaches for each setting are required, though there might be things that can be carried over, and more attention needs to be placed on this according to what the authors of this piece are talking about specifically. And the other factors that should be considered as well include the demographics, the differences in demographics between a city or urban center, and compare that to a more suburban rural communities, which tend to skew a little bit older. So ensuring that the nuances of these different differences are captured in the way that those communities are designed is very important.
For sure. I think, like, for example, in a city, since a lot of younger people tend to live there, you want to incorporate bike lanes because these are the folks that will tend to use those. Whereas in a rural city, obviously a lot more people will be driving around. And that's where you really want to incorporate maybe something like a community center that has classes for older adults, that has fitness classes, classes that allow them to be physically active, but that's also in a closer vicinity to their home. Maybe it's located in a walking distance. They're able to walk to these community centers, maybe not drive there. And that will really help with promoting activities and maybe even making, I think that goes beyond just the physical activity aspect of it to even forming a sort of community. I think social connections and social networks are also such an important factor that plays in our health, especially when folks are older. I think isolation and loneliness is something that is definitely impacting people's health. And if we're able to form this sort of community through community centers, also allowing these folks to be physically active, I think that's tackling almost two birds with one stone. And you're able to promote healthier lifestyles in a place that's not as urbanized.
Mm-hmm. And in particular, if you think about it yourself too, the walkability in suburban areas is not that good. So those areas, whether it's intentional or unintentional, are designed in such a way that a vehicle is required to be transported around. And the unintended consequence of that is that it promotes sedentary behavior, more sitting, less physical activity. And those are the factors that contribute to obesity and not being active overall. So I think that this is important to capture from public health as well, Bindra. You did mention the importance of planners working with public health. And I think these are some of the things that, from a data perspective, that public health can use to inform planning to ensure that those different communities are designed as a reflection of the people living within them.
I think public transportation is key. You want to make sure that there's access to public transportation because if it's not walkable, if we're promoting or we're asking individuals and encouraging them not to use their cars, then we need to ensure that there is access to public transportation, maybe an LRT system, maybe buses, things like that. I think if we don't have something like that, then folks will not even be able to walk as accessibly around these areas too.
And access, one box checked. Quality is another box checked. So you can have some of these folks might have vehicles already, so they have the choice of using a vehicle versus public transit. And if they don't see the value of using public transit over their own vehicle, then they're not going to use the system. So also making sure that in addition to access, the entry points make sense, the frequency at which the transportation arrives makes sense, the duration of which it arrives makes sense. It goes to key locations that people would be interested in. So those things are important too. And I'm not a planner myself, but I would imagine that these are the things that they're thinking about. But much like access to healthcare, you can drop a hospital in a community, but are there existing reasons why people don't trust that? So there's a lot of barriers, even if there is access, why
100%.
a service wouldn't be used, and not neglecting those barriers is very, very important. You just heard us talk about the cost of living crisis and why it's a public health issue, and the concerning new trend of patient influencers from a drug advertising and marketing perspective, and how that could lead to drug shortages. And lastly, about why planners must consider the differences between cities and more suburban areas in terms of community design to promote physical activity. This is Bindra and Gordon, your favorite public health professionals, signing off. Until next time.
Bye.
Peace. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.